Hi, my name is Esther DeYoung. I'm a certified nurse midwife. I've been practicing for 30 years.
And my name's Kate Paxton. I'm also a nurse midwife and have been practicing for 5 years.
And we are making this video to encourage our representatives to vote yes for SB187. And this, of course, is the bill that would allow experienced APRNs in high-need areas to practice without a CPA, which is a collaborative practice agreement.
APRNs are advanced practice registered nurses, which includes nurse practitioners and nurse midwives like us.
So, Kate, there aren't very many certified nurse midwives in Louisiana. I used to live in Florida, and there were hundreds in Florida.
And there were hundreds in Arizona and New York where I've worked. So why is this? Are we not needed?
Actually, we are very much needed. There's a great need for maternity care in Louisiana. About half of the parishes in our state do not have even a single obstetrician to care for pregnant women. We have #1 C-section rate in the whole United States.
And we're second for both infant mortality and tied for second for preterm birth.
These are not good rates.
Statistics, no.
Can CNMs help with this?
Yes, numerous studies have shown that midwifery care is safe and effective and at least as good as physician care for lower risk women.
Midwifery is associated with substantial cost savings because of our focus on normal physiological birth and our decrease in interventions.
There's many experts who recommend independent full practice authority for APRNs, including the Federal Trade Commission, the Institute of Medicine, AARP, and the National Governors Association.
And they're all listed here, and you should have this on your desk.
I wonder why we don't have more midwives practicing in Louisiana.
You know, one of the keys is that collaborative practice agreement. It's very difficult. We cannot practice unless we get a physician to sign it, and physicians are very hesitant to do that.
They feel like they're taking unnecessary liability, and there's no strong reason for them to do so. Research shows that twice as many midwives practice in states with autonomous practice regulations. Esther, you opened an independent midwifery practice in Louisiana in 2010. Was it hard to find somebody to sign your CPA?
You know, it was hard, Kate, and I worked with 2 other midwives, and we worked several years trying to get a practice started, and we were unable to do so. And then I met Kathy Batto, and she had a good friend, and a good friend helped us out. The original nurse midwifery practice here in New Orleans was started by Terry Berthier, who happened to be married to an obstetrician. So certainly as professionals, we should not have to depend on husbands and good friends to help us practice and provide this essential care to women.
I agree. So there's a need for maternity care. Nurse midwives can meet that need. We can have more nurse midwives without the CPAs. I wonder why legislators would not vote for this bill.
I can tell you some of the concerns I've heard. One of the concerns is that our scope of practice would change, that we would expand what we're doing outside of what we should be doing. Now, I think you can address that, Kate, because you've lived in, or you've worked in 2 states where they didn't have collaborative practice agreements. Did you practice differently? Was your scope of practice different?
Not at all. My scope of practice was the same in Arizona as it is in Louisiana, and it's based on our training. My father's a physician in Arizona, and I basically grew up listening to all of his stories about his patients. He's an internist, and he had many patients that he saw on his own, and then occasionally he'd have a patient that he needed to send to a specialist. Nurse midwives and nurse practitioners are very similar to that. So our scope of practice doesn't change based on our legal regulations, it changes based on our training, and our training is the same.
It's very spelled out what we can do in our training. And another concern I've heard is that physicians feel like we're trying to cut them out of healthcare, that we're trying to replace them. But from what I heard you say, we still would collaborate, we still would refer, we still would work with physicians.
That's true. So in a day-to-day practice, in both of these different states, I saw mostly low-risk women, and I could take care of them on my own. Occasionally I might have a question that I might call and consult with a physician about. And occasionally I'd see a patient who is completely outside of my scope of practice, and I would say, you know, thank you for coming to see me, but I don't think I could do safe care for you. You'd be safest in the hands of a physician, and I would transfer care for that
And
patient.
so that's what you did without a collaborative practice agreement, and it's very much what we do with a collaborative practice agreement.
Very true.
So the other topic that I've heard, the other concern is safety. They worry that we are not as safe as physicians.
Sure. So that topic has been very well researched, and the results are very clear. This is a systematic review of advanced practice nurse outcomes from 1990 through 2008, and it reviewed all the published literature during that time, comparing the patient outcomes of care provided by nurse practitioners and nurse midwives in collaboration with physicians, and found that they were similar to, and in some ways better than, care provided by physicians alone for the populations and the settings included.
And AANP has summarized 19 studies that showed similar results, and this also should be on your desk. Also want to point out that 26 states don't have a collaborative practice requirement, and those states have very good statistics.
Yes.
So this is a proven thing.
Yes. So as practitioners, we really try and be evidence-based in our decision making. We're hoping that our legislators will also hear this research, support this bill, and say yes to SB 187.
Thank you.
Thanks.
Support. Thank you very much.